so we can fix the coronary artery, okay? And it looks something like this. If you can imagine, you have your heart here, and you have a bunch of coronary arteries split up everywhere. Well, some of those coronary arteries, they have atherosclerosis. And what we end up doing is we have the aorta that's like this. The aorta actually goes behind the heart, man. And it becomes the femoral artery. You remember the femoral artery?
Mm-hmm.
All right, cool. So we have to get a catheter through that blood vessel wall so we can fix it. How do we do that? Through this procedure: percutaneous, transluminal, coronary angioplasty. We have to fix it because the issue with this one is you have the blood vessel and you have all this plaque buildup in there that's causing ischemia. What does ischemia mean?
Ischemia.
Uh-huh.
Low oxygen in the tissue.
That's correct. So we have to find a way to fix that. So what we do is we insert a catheter through the femoral artery. We go through the skin because, you have to go through the skin to get to the femoral artery. And we put the catheter in this way. And the catheter goes up behind the heart through the aorta. And then we find our way inside here. And so that catheter, if you can imagine, it's going this way.
And is that going to a vessel or is that
That's
just
correct? Yeah, it's going through the vessel. It's going through the coronary artery. It's going inside the coronary artery. And we have a little device on the tip that's a little balloon that's like this. And it's not inflated just yet. But what we can do is we can inflate that balloon and we will be pushing all of that plaque buildup against the wall, which is going to open the vessel. What's the word for an open vessel?
an open vessel?
Yeah.
I don't know.
The P. It starts with a P.
P.
Patency, bro.
Oh, okay.
So what we do is that plaque buildup gets squeezed against the wall of the blood vessel and it creates patency. It opens up because that little catheter, it has a little balloon on it, and that little balloon inflates.
And then there's that end of the tube section of the.
No, you don't need to suction anything out because you're squeezing the fat against the blood vessel wall. So you're kind of like flattening out dough, or in this case, fat. And so when you flatten it out, it reduces. Then we take it out, and now look at that. Now you've created patency.
And then do you have to go back in the future and do that surgery again?
If you don't stop your dietary choices that are contributing to your atherosclerosis, yeah, you're going to continue it. You're going to have to continue to do this. But when you were telling me about your uncle, he probably had to have a procedure that's a little bit more invasive than this, where they had to remove the blood vessel and transplant it with a healthy patent blood vessel. But we'll get to that in a little bit. This is the percutaneous transluminal coronary angioplasty procedure that was in the question. What you have to understand is that the goal is to create patency. The issue with a patient that needs to undergo percutaneous transluminal coronary angioplasty is they have a disease that is caused by atherosclerosis and arteriosclerosis, right? But it's called coronary artery disease, or CAD. And this coronary artery disease is everything we've been discussing so far in regards to the plaque buildup within the blood vessels of the coronary arteries. And that leads to what we discussed earlier, ischemia, which we described as being a lack of oxygen to the tissues. That contributes to angina, which is a chest pain. And if we don't fix this, if we don't do a PTCA, which is this procedure, or if we don't change or modify our dietary habits, or if we don't give them medications like nitroglycerin, then eventually that angina will develop into a myocardial infarction. Because that tissue is going to end up dying, and the death tissue is going to get bigger and bigger, and that's going to lead to heart failure, because now the heart that's supposed to pump the blood throughout the whole body, throughout the whole system, it's dead. The walls on the muscles are dead, and that's not going to allow for proper pumping, which is going to reduce the cardiac output, which means you're not going to have enough blood going to your brain and to your feet and to all the other organs that it needs to get to. And that's why we have this procedure of percutaneous transluminal angioplasty. Is that clear?
Yeah.
Okay, good. Let me explain a couple more things. Now your job as a nurse is not to do the procedure. That's the doctor's job, right? But you have to understand as a nurse that this procedure is being done in this way. So you have to assess for things that may go wrong, for some complications. To start off, this access port right here through the femoral artery, we understand that femoral artery is supposed to send blood to the feet, correct?
Correct. So there's
So
oxygen enough
that's
everywhere.
that's correct. So you have to do an assessment. And your assessment deals with what we call neurovascular status. Nerves and vessels. We have to find out how they're doing, because if we do that PTCA, we put that catheter right here on the femoral artery, it is likely that the artery is going to continue to bleed internally. We won't even notice it because, the skin of the leg is like that. So the patient might be bleeding inside. How do we know? Well, we can assess the foot. By assessing the foot, okay, we can find out if the blood is actually being sent to the foot. And we do that by assessing the circulation, the motion, and the sensation. This is also known as CMS. If you do CMS, you're assessing your neurovascular status. The circulation assesses to see if there's blood flow. That's the vascular part. You can do the capillary refill. You can do the dorsal pedal pulse. You can check the temperature of the foot to see if it's warm or cold, because it's supposed to be warm. Motion, if the patient can move or wiggle their toes, that means that they have adequate blood supply. And also nerve conduction. And then sensation, it lets you know if the nerves are being affected, because when you have ischemia to any tissues, you also lack sensation. So if we're bleeding from this area and there's not enough blood flow to the foot, then we know that the patient will not be able to feel anything, or at least they won't be able to feel certain segments of touch or other type of stimulation on the foot. And that lets us know that the patient is not doing well, that there's some complication going on due to this procedure. There's probably bleeding or nerve damage. Does that make sense?
Right.
Okay. And to elaborate on that, your book also talks about the 5 Ps. This is, again, bro, these are just little tools that we use to try to help us get back to the topic on hand, which is neurovascular status. If the patient develops pain, if the patient develops pallor, if the patient develops paresthesia, if the patient develops, what's the other one? Poikithermia. I'm not going to write it, but poikithermia is the inability to regain temperature of the foot. It develops pallor. That's the 5th one. I got the 5th one there. So again, pain means ischemia. There's something wrong. Pallor means you don't have enough blood supply. There's something wrong. Paresthesia is the tingling sensation that you get when your leg falls asleep. If the patient develops that, that's a problem also. Poikithermia is another one that's going to be problematic. And then let's see, pulselessness. If there's no pulse, that means that there's not good neurovascular status. So these two things, this number 1 and this number 2, they're describing the same thing, bro. They're assessing the neurovascular status. I'm just giving you everything you may encounter in these questions in regards to these procedures and in regards to what we're assessing for. You have to understand a lack in any of these, meaning a lack in circulation, a lack in motion, a lack in sensation. If there's pain, if there's no pulse, if there's pallor, if there's paresthesia, if there's poikithermia, then that means that the patient has a compromised neurovascular status and it needs to be reported. Does that make sense?
But if that's reported, you can't do the bypass.
The bypass is a different procedure.
So what is this meant to check for then?
You're trying to check to see if there's adequate blood going to the foot.
Oh, okay.
Because I know that the procedure is to assess the heart. I understand that. But us as nurses, there's a limited amount of participation that we're going to have when it comes to the actual procedure. What we have to know is when we're getting the patient when we're getting him or her ready for the procedure, we have to do a neurovascular assessment so we know what to expect after the patient comes out of the procedure, to see if the patient actually damaged that artery and to see if they're bleeding internally. Does that make sense?
Right.
Okay. Can I clear this stuff out?
Go ahead, boss. Thank you.
Thank you.